I'm Dr. Michael DeTola.
And I'm Megan Strong.
In this week's Case of the Week, a dentist gets burned by letting the patient select the B1 shade. I think these crowns look good, doctor.
And in the news, just when you thought your kid's tantrum was bad, this 5-year-old takes it to an emergency level.
And Megan digs up a commercial from the ADA from the 1960s. That's sure to have Chris Hansen's ears burning. That and more on today's Chairside Live. Hey now, hello and welcome to episode 135 of Chairside Live. We've got a great show for you today. Megan, how are you doing?
I'm doing well, actually, and I'm rather prideful today. I am proud because my husband, Brandon, graduated college yesterday.
Really?
On Monday, yes, 2 days ago.
Really?
Yeah, so he's been going to school while working and being a dad and a husband and everything, and he just got his degree in graphic design. So.
Wow, congratulations.
Yes.
So is he that's what he's doing as part of the work that he's doing while he was going to school?
Okay. And he was doing designing for, he was actually doing screen printing as well, so he would design and then do shirts and whatever. So now he graduated and it's time to get a job.
Awesome, congratulations. That's what I did. I did dentistry for 7 or 8 years and I thought I should go to school for this. And so then I went to school to supplement my knowledge just a little bit.
Yeah.
And it worked. And I graduated like 10 years into my career.
Nice.
So it was impressive.
Scary.
Well, we've got an interesting case of the week for you. Actually, we have a little bonus one tacked on as well. We've got one that's going to look at a doctor who requested a scan and save case for 4 anterior e.max restorations. And we're going to take a quick peek at some new study models available to you from the lab. In fact, let's look at that now. This is a case where a doctor wanted to take advantage of the scan and save program that we've talked about before on this show. So he's going to do restorations on 7, 8, 9, and 10. Looks like a pretty good case for that because cuspids look to be in decent position, but we've got just some slight rotations there on the centrals and laterals. And so he asked us for, and of course we can't see, we don't have photographs or x-rays, but he asked us for biotemp crowns on 7 and 8. And then he asked us for biotemp veneers on 9 and 10, splinted together. Actually, both sets were going to be splinted together, not as a 4, but 2 and 2. And so he was going to prep these 2 for crowns and prep these 2 for veneers. And he wanted a prep guide for the veneers. And there's different ways to do this, but some doctors are just happy with a stone model like this. So we'll zoom in just a little bit to see, and hopefully with this being pale yellow stone, you'll still be able to see it. So these 2 teeth are prepped for biotemps, and so those are the lab fabricated crowns that the dentist relines chairside. So these are prepped pretty minimally, and this is for e.max, and so you should be reducing more than that on e.max. So it kind of gives you a rough guide of what the crown should look like. And then here's kind of the prep guide for the veneers, or at least how much was prepped to be able to make the temporary veneers. The doctor did say that he wanted to shoot for ideal alignment, and so wanted to get rid of this rotation. The distal part you can see of the central incisor is pretty kicked out. So on the prep, you can see most of that's been taken care of. There's now kind of an ideal arch form. Of course, it's going to be 0.3 of a millimeter that we add in terms of e.max to both of that. Looks like the technician does want to have that incisal edge wrapped and just kind of going to a butt joint on the lingual, which is what we prefer. It can be a butt joint that slants a little bit towards the lingual, because that way the e.max that's sitting right here on the lingual of that incisal edge will provide some mechanical resistance when the patient goes into protrusive. So we don't necessarily like to have this be totally flat. Like if you look at a veneer prep from the side where the incisal edge would just be flat like that and the veneer would just end, it could, but having it slant back like this just a little bit when you prep that edge does give some resistance form to that veneer from popping off to the facial, which usually seems to be the way that those pop off when they pop off or break. And so a little carrying it down in between here. And the reason why is to make sure we close the contact between those two. So that gives the technician the ability to carry that e.max interproximally. So we are going to have to go interproximal on that prep as opposed to just kind of keeping it still. It lets them control that midline where they're going to put it if we give them the preparation to be able to wrap that e.max interproximally. And so let's look. Here's what the Scan and Save RX looks like. So this was what was designed in CAD/CAM, and you can see the different lengths of the teeth that are here. And the dentist is able to put the temps into the mouth and see if they want to change the length. Of course, the length, 10.5 millimeters, about the average length for a central incisor. You can see number 9 is just a little bit shorter. That's because of gingival position, not incisal ledge. So that's currently what's happening here. And you'll see that a lot of times where they don't line up just because of differing gingival level. So golden proportion is used here when designing these. And of course, if the doctor and the patient like how this looks when the temps are in the mouth, we simply can go in and, using this same design file, mill the e.max restoration so it matches the temps perfectly. We used to give a lot of lip service to this, 6-7 years ago, but it was all being done by hand and kind of guessing. CAD/CAM has really kind of changed the game here. And the dentist requested B1 was the shade that he and the patient had decided on, or somebody decided on. So we get an impression from the doctor. We get a bite. We're not thrilled by pink base plate wax bites, but I'll say this. If you're going to take a wax bite, this is the way to do it. It's got to be thick. It's got to be not only several layers thick, just around the periphery, but you can see it's just been built up, kind of rolled into a hot dog, if you will. And it's thick, and when I push on it, it definitely actively does not want to be distorted. Now, if you just use a single sheet or two and have the patient bite into it so it's thin everywhere here, because all the unprepped teeth are going to be very thin, then we do in fact have something that distorts and makes it difficult to use. It's this big lingual bar of wax that you see back here, and the one on the front. Those two that are primarily responsible for me not really being able to distort this. It distorts anyway because of hot and cold a little bit, but this is still very usable just because we have this big thick rim of wax on the facial and lingual. So roll it into a hot dog if you want to use base plate wax to do this, or use a polyvinyl material, blue mousse, whatever, or I like bisacryls like Luxabite because they're insanely stiff. And then we'll look at the impression, and it's a full arch. We like that. It was done simultaneously. You can tell by the way the green and the blue material have merged together. That's a little iffy, right there on number 9. I should go back a step. Well, you'll see it here on the model. The veneers are already in place. And the veneers are in place. The B1 veneers are actually in place because when the doctor first tried everything in, the B1 veneers looked good, but the B1 crowns don't. And that's a lesson to be learned. In fact, the only time I've ever seen B1 work, there's 2 occasions where B1 works. Next to another crown, that's a verified B1. So if these were crowns instead of veneers, and we were doing 2 crowns here in B1, pretty good chance they're going to match. But B1 as a veneer material, as a bleached veneer material, bleach shade, will work, but when it gets to be a crown, it just doesn't look like a tooth anymore. So B1 veneers, 0.3 of a millimeter thick, even e.max veneers like this, can look decent. I'm not a fan of values quite that high unless we're matching 8 other restorations that shade. But when the B1 crowns run into place, things really look fake. In fact, B1 looks better on the shade tab, and it looks kind of striking there, better than it does for crowns here. So the veneers went to place. The patient was happy with those, but these look like white tombstones, fluorescent white tombstones. And so a new impression was being taken so we could bring the value down a little bit, somewhere between a B1 and an A1. And there was a photograph that was sent with the shade tab in place. I didn't print it from the computer. But when we look at that, we can see that now the issue is really just some indistinct margins. And you saw that area where we had that pull on tooth number 9. And as we look around in just little bits and pieces, you can see that we can in fact see like a little retraction there. You can see the margin there, but then it just disappears completely on the facial of 9. And when we go to our facial of, I should say that's tooth number 7. And when we go to number 8, you can see that we've got this nice margin there that can be identified, but then again, interproximally disappears. And then we see a little more on the mesial of the central, and then it kind of disappears again. And so unfortunately now we're going to need to get a new impression from the doctor, and the doctor's going to have the patient back again. This will be the second time. The first time was when the crowns didn't look authentic enough in the patient's eyes. And now we just have an indistinct impression here. It doesn't really look like like retraction cord was used. If it was probably just one cord. But furthermore, a diode laser could have helped just to get a little trough around there and be able to see it. But that's a little too much guesswork, and it's too bad because you can see, you know, where the margin is around here, and it's actually nice and well developed and could probably be trimmed there almost completely on that lateral. But then there's just too many other areas where it's just indistinct and it's going to be too difficult to guess. On anterior teeth like this, you can't have that margin be exposed when it shouldn't be exposed. So we do, in fact, need a little retraction, and then that case should be able to be a success, especially with that scan and save where the doctor knows and the patient knows that the final restorations are going to be the exact same size and shape as the temporaries were. And one last thing that has nothing to do with that case. I've been getting a lot of requests lately for samples for something that I showed on the show a while back, which was the Bruxer full arch bridge. So this is the Bruxer full arch implant retained bridge. So you can see this one's set up for 6 implants here. And this is a solid piece of zirconia that's been colored for the tissue and colored for the teeth. So that gets painted on in the green state, and then color gets added even after it's sintered. And it's really heavy. If you could hold this, you could see exactly how heavy this is, and it gives the patient an idea of what kind of strength we're talking about with something like this. And the other thing we do is a PMMA sample as well. And the PMMA, if you recall, before all the milling and all the staining that goes into the zirconia, the final prosthesis, there's one made out of PMMA, and this is the trial one that dentists will put in the patient's mouth and leave it in for a couple of months and let the patient go through excursions and talking and chewing. We want to get everything dialed in on this PMMA one, which is the transitional kind of temporary one. And then once everything is changed on here, you know, everything's kind of ground in, any adjustments are made, then that is going to be translated back to the technician and be incorporated into this final bridge. So both of these are available as full arch samples and as 6-unit samples or 8-unit samples as well. And the cost for these, for the larger zirconia one, is $620, I'm pretty sure, and the smaller one I think is $440 to have these as a sample. They're not for use in the mouth. I guess you could try to line up 6 implants on one of your patients and see if you could make it work, kind of reverse it all, a reverse surgical guide, if you will. And the PMMA one, which is much lighter than this, the transitional one, this is available for $180 for this particular study model, and then the smaller one is $145. So if you're looking for, and that's obviously much cheaper on both of those than the actual restoration for a patient will be, because it's a lot less technique sensitive in the sense that we just mill something already and it doesn't have to fit, and we just have to do all the coloring and everything else. So much quicker for us to be able to do multiple copies of. So anyway, if you're providing this type of dentistry or considering providing this type of dentistry, or you have a specialist who you want to work with to place the implants to provide this, just wanted to show you that we do, in fact, you know, dentists had been requesting samples and they just weren't available. But now it's been figured out how to do it and what to charge for it. So if you're interested, the Bruxer full arch prosthesis and the PMMA full arch prosthesis can now both be ordered from us to be able to educate patients on what kind of treatment's available.
Thank you for that, Dr. D. Now let's go to a segment we call Viewer Mail. For this week's viewer mail, it actually is no mail at all. It is a video that I found from the American Dental Association, and I thought you would like it, so we should take a look.
I didn't know they made videos.
Well, they do.
I've been saying for a long time that if they just made, not a video, but a commercial, if there was just like one commercial for periodontal disease or something, and they put it in the Super Bowl, and that was the one thing they did every year that, you know, people would, if it was gory and scary enough, people would probably call up and make appointments. But
yeah, the shock factor, maybe it would work. But
well, awesome. Okay, so there's a, it's from the ADA?
Yes.
All right, let's take a peek at this.
When I was a boy, I used to run to his office. The guys like to kid me. Running to a dentist.
I like that. So first of all, he's that excited. My dad was a dentist,
Okay.
and I used to get money from him, and
Yeah.
I still walked at a reasonable rate. I wasn't running there. But I like how the kids who are giving him a hard time, what are they doing hanging out in front of the dentist's office?
Right.
I mean, is that
Like that's the new hangout spot? I'm not sure. But
it's not like there's some local toughs out there, smoking a butt in front,
Right.
making fun of him for going in, but they just happen to be hanging out. And it does look like we're in the guy's house, it looks like.
It looks like there's some furniture. It does look like a home. You're right.
And so in a lot of practices on the East Coast, this is how they used to practice, more so than on the West Coast, where downstairs would be the dental office and upstairs would be where they lived. And so,
Sure.
but it's just funny to kind of look here and see dental equipment and then the couch
Right, and the
right in the
whole
back.
bouquet
But maybe
of
that's the
flowers.
reception area.
Yeah.
Okay, let's.
But he was some dentist. His name was Dr. Brand, and he always let me come 5 minutes early just so I could see his lab.
There we go. Don't touch that. That's 900 degrees. Don't touch that, kid. We have an oven like that
Yes.
out in the lobby. That's from this must be from, I don't know, the 60s or something like
Sure.
that, and that's when that oven's from. But I like that the kid's coming, and this is what he's really excited by is the lab equipment. He doesn't want to see the drills and the needles. So, show me that easy bake oven where you can do porcelain crowns. That's what I'm really
Can you
excited
bake a
about.
cookie in there?
When I went to dental school, even when I went, this is what we wore. Well, actually, you could wear a shirt and a tie and a white coat, or this kind of Sweeney Todd, killer barber,
Right.
white thing that would button on the side like that, kind of like this guy's wearing. But he's got it rolled up. This is a very, very casual look.
Laid back.
Right.
going
I'm
for it.
surprised there's not a line of other children waiting to get in to see the lab equipment, but he appears to be the only one here at the time.
Tell me about them. I used to get so excited, I'd tell Dr. Brand I was going to be a dentist when I grew up. And he'd pat my head.
Oh, wow. That might be the first Tousle on record. There's been, it started around that time where every time in a movie you needed something poignant or a kid did something cute.
Right.
It was always like a
Don't you dare.
rub, of the head like that. And it
That-
just constantly happens.
It went hand in hand with the attaboy. Attaboy.
It did.
Yep.
It went along with that, and it's good to see the dentist knew that. They didn't teach that when I was in dental school, what to do if a young boy shows up and wants to see your lab.
And he'd pat my head and say, fine, fine.
Fine.
Only he never told me how hard it was to become one. When I was older, I learned. He went to college for 8 years.
All right, now I'm not trying to impress this kid. He's
Okay.
probably 90 at this point, but
Right.
I went in 6 years. And it's now like an official program where you can go in 6 instead of 8, but I probably should have spent an extra 2 years to be honest.
Okay, well,
but-
I don't want to impress both of you, but I actually got my 4-year degree in 3. So
Really? Well, I don't really want to one-up you,
okay.
but I finished high school in 8 weeks.
No.
It was a very accelerated program, and I was able to do that. I like how he the kid reflects back on it now. I guess this is later in life.
Right.
So somehow this boy got vintage footage of him walking into this dentist's office, and now he's reflecting on it and saying, he didn't tell me at the time how hard it was to be a dentist. And I feel like, mid B's, even some high C's, I feel like you still get in. This kid must have really slacked.
He went to college for 8 years and had to study dozens of subjects, not just dental ones, but physiology and anatomy and bacteriology.
Bacteriology.
Is that a thing?
I don't think we had a course called microbiology because I think by this point we knew there was things called viruses. It sounds like here it was just bacteriology. There's probably just like 4 bacteria, and the
Sure,
course wasn't all that difficult at the time. Mind you, he studied bacteriology, but he's about to work on this kid with no gloves on. The sterilizer that they had in the office, just like my dad's, they never tested it with a spore strip to see if it was actually working. They just assumed if the red light came on that it was working. So it must have really impressed the kid that this was some high-tech stuff going on.
Of course, I didn't know that then. All I knew was that going to Dr. Brand's was better than the movies. Somehow I never did become a dentist.
Oh, what are you doing? What are you doing? Oh, you can't leave that hanging. First of all, better than the movies.
What kind of movies has he been seeing?
It might be all like Davy and Goliath videos or just something kind of awful that...
Was Lassie out at this point? I mean, come on, something.
Right. Well, a lot of times I'll hear people even today say, boy, I can't decide if I should go see that new Star Wars movie or go to the dentist and play in his lab. And I like how he likes how high-tech it is. Meanwhile, right behind him, there's this
I'm
uncollimated...
so glad Dr. Brand did.
X-ray machine
What he
that's
showed
sitting
me
there in the
about
back
taking
waiting to
care of
spread
my
radiation all throughout the living
given
room.
me what he calls a smile for life.
Ah,
Oh, wow.
Smile for Life, the tagline. I bet they started with that and then built the commercial backwards. I feel like I ruined it because we talked over it. So let's have producer James show that at the end in its entirety. It looks like it's about a minute
around.
long.
Please watch it.
'Cause I feel like we ruined it.
That's all right.
And by
No.
we, I mean me.
Right.
That's great, though. I wonder what it would look like if they did something like that today. You know, if they tried to really make kind of an image ad today and what
Right.
it would look like. It would be obviously super high tech, and I don't think they'd go for the little kid shunning his friends to hang out with the dentist.
I don't think it would have that Leave It to Beaver sort of a feel. I think it would be much, much different today.
Right. And don't you think that if a young kid, like a 7 or 8 year old kid, said, "Mom, I'm going to run over to the dentist's office. I'm going to go take a look at. I'll go alone. I'm going to go he wants to show me around the lab."
That would raise some serious red flags.
Are you taking some friends with you? No, I'm making them wait outside. There's not even going to be any witnesses. Dr. Brand said no witnesses allowed.
By the way, it's at his house.
And it's at his house as well.
Oh,
What a simpler time.
Yes.
You know, there was no seatbelts in cars. It was a great time. You hit the brakes, kids just flew through the windshield. Something happened, you had more. They could trick or treat on their own. They didn't need a chaperone to do it.
Oh, gosh.
What a great time. That's making me nostalgic for the period of time 4 years before I was born that I never experienced. All right, well, thank you for that. I appreciate you finding that. Any news?
Yes. Most of us have seen true dental emergencies, but it sounds like a young girl in Wisconsin might have been overreacting. The 5-year-old girl called 911 and said her mom was going to take her to the dentist and she did not want to go. The girl hung up before the dispatcher could talk to the mom. When she called back, the mom was shocked that her daughter had called 911. The mom said she's just happy that her kids know the number to call for help.
Right, and 4 people having a heart attack died during the call.
Right. But I think it is hilarious that, of course, 911 should be reserved for true emergencies, but it is sort of comical that she called and said, "My mom's trying to take me to the dentist, help."
Right. I wonder if she's been before. I wonder if this is it must be a reaction to this particular dentist. You know, I don't think she could really at that age have a notion of dentists in general, or maybe a friend said something. But she needs to talk to little Timmy. Right. Little Timmy in this ad would rather go to the dentist than go to the movie. He never even thought about calling 911, which didn't exist at the time.
Right.
We should show this to her
and
make her feel a lot better. She needs to show up 5 minutes early and go play in the lab, get her hair tousled, and then go sit in a chair and well, it cuts out there. We don't know what happens there, but it is funny. It is humorous that she would call 911, and we've heard much. I don't know if you've ever heard, but like on some radio shows, they'll play 911 calls where people call because I think they're inebriated. But I've heard 911 calls where people call because they drove through McDonald's but didn't get their McNuggets. Yeah, exactly.
Right. Yes,
so
that's
this
one
is
of my favorites.
Cuter than that.
Yes.
And but I just wonder, that's what happens to that 4-year-old that she's that panicked. I mean, this is somebody who's probably going to be a dental phobic for life because she heard something awful about what's going to happen. Sometimes it's the parents just promising, if you're good when we go to the dentist, if you come back alive from the dentist, we'll get ice cream for you. And the kid's like, what's gonna? I don't get offered this for anything else.
Right, so
what exactly is about to happen?
Why am I getting set up for this? Yes, and if you see if someone's hysterical, it's historical, meaning that somewhere in the past, like you mentioned, she must have gone to the dentist and something scary in her mind happened, or like you said, maybe a friend told her the dentist was the boogeyman or whatever, but that would probably explain the hysteria of her calling 911. Right. But hopefully she went to the dentist and had a good experience that could change it for her.
They also say that if there's a hysterectomy, there's a well, okay, forget it.
No,
it's
I
not
don't
going to work.
think
I just thought I'd try to follow you on that one. Anything else?
Yes. The government is lowering fluoride levels added to drinking water for the first time in more than 50 years. Officials say that some people are getting too much fluoride because it is also now put in toothpaste, mouthwash, and other products. Since 1962, the government has been advising water systems to add fluoride to a level of 0.7 parts per million for warmer climates and 0.2 parts per million in cooler areas. The new standard is 0.7 everywhere.
That's interesting because there's been fluoride in toothpaste forever.
Right.
I mean, I don't think there's fluoride in that many more things. I think they are making kids' toothpaste in better flavor, so kids are more willing to swallow it. But I always kind of felt the other way, like they should leave it where it is, because every time I look around, kids, teenagers, everyone's drinking bottled water. You know, they're
Yep.
drinking bottled water like this that's got no fluoride in it. It's essentially distilled water.
Sure.
It's not mineral water like Perrier. And so instead of drinking tap water primarily that's got fluoride in it at 0.7 parts per million, they're drinking this. And so I figured that kids today, like I know parents who, if I got yelled at once, I think, for giving one of my son's friends tap water, you know, by the mom, because it wasn't bottled water. Like, we were in Orange County and the tap water was going to be awful because he wanted a glass of water. Because I didn't have time to run it through the Brita or anything else.
I will say though, tap water, and I've lived in South Orange County my entire life, but the tap water here, I have to admit, is not that delicious. If you go up to like where I have family in Redding in Northern California, and it's by the mountains, and the water is amazing.
We don't have a mountain to get ours from. We have to get ours from the source at the Santa Ana River. And that's why it tastes like shopping carts. Because a lot of times it runs past those and picks up some of that metal.
Oh, goodness
And it's pretty
gracious.
awful.
Yeah, and actually in the story they were saying that researchers were talking about how a lot of times with too much fluoride that the kids will get the white spots on their teeth.
Right.
And so they were quoting that as to maybe a reason why that they were wanting to lower it. And I'm thinking, okay.
Well, they're not necessarily white. I mean, most of the white spots we see are from kids having braces and they get some
Right.
decalcification, but there are spots and they can be colored spots. Dentists have always been very quick to call it fluorosis, which might have given fluoride a bad name, but it's just been a good public health thing, especially for inner city kids who weren't getting chewable multivitamins
Right.
from their pediatrician. So I think it's the right thing to do, but you know, you can't ever, for some reason, it's just got this thing in the population, like the dentists are behind this. It's like, why? Why would we be behind this? It's less work for us. Granted,
Sure.
we don't want to work on kids. So
Right.
in one sense, we're trying to make our lives a little easier,
Right.
but God knows we want to do crowns on adults. So
Right,
I've
yeah,
never
it's-
understood why
yeah.
they thought this is some kind of cover-up on the part of dentistry. All right, well, thank you for that.
Conspiracy
That
theory,
about
yes.
wraps it up for this week's edition of Chairside Live. On behalf of myself, Meg, and the whole CSL crew, and everybody here at the lab, I want to thank you for your time and your continuing commitment to quality dentistry.
We'll see you next time.
Sure. And I don't know why. Doesn't everybody want crowns that look like this?
And in the news, you thought your kid's child... And in the news, just when you thought your kid's tantrum was bad, this 5-year-old takes it to the next level.
Boy, does she ever.
Tussle my hair. Oh, but
I get to keep it for now until you say the magic words.
I know, but you just spilled.
Oh,
I mean,
oops.
don't tell James. Okay, ready?
When I was a boy, I used to run to his office. The guys liked to kid me, running to a dentist. But he was some dentist. His name was Dr. Brand, and he always let me come 5 minutes early just so I could see his lab. And he'd let me touch things and tell me about them. I used to get so excited, I'd tell Dr. Brand I was going to be a dentist when I grew up. And he'd pat my head and say, fine, fine. Only he never told me how hard it was to become one. When I was older, I learned. He went to college for 8 years and had to study dozens of subjects, not just dental ones, but physiology and anatomy and bacteriology. Of course, I didn't know that then. All I knew was that going to Dr. Brand's was better than the movies. Somehow, I never did become a dentist, but I'm sure glad Dr. Brand did. What he showed me about taking care of my teeth has given me what he calls a smile for life.